Let's continue on with who you're going to listen to about what to eat. I'm Dr. Greg Ellis. I've been discussing the recommendations that we are brainwashed with every single day about what's good for us. And I've argued the point that none of these people are doing the actual research. They're not reading research papers. They're not seeing what the science actually says. And those papers get published in medical journals, scientific journals, and they live in the basement of a medical school. And who goes in there but nutcases like myself to read these things? Of course, a lot of this stuff you can pick up on the internet, but you have to know how to search and how to retrieve articles, which I'm very good at. I've been doing it for many, many years, and all of my books have been based on research. So I've retrieved all that stuff. Now, the argument that I'm posing is that you're just constantly getting brainwashed about what's good to eat. And the information you really need to get your hands on is just not readily available for you. So here we go with the Sunday newspaper, and we've got USA Weekend titled, What's Left to Eat? What's Left to Eat? So now this little baby is distributed in many Sunday newspapers all across the country, and millions upon millions of people read this stuff, and the healthy recommendations are in here. You can find out exactly what you need to eat. Now, there's no real surprise of what they tell us is good for us. And they say, fill your plate, lower the fat, with unlimited combinations of vegetables, fruits, seafood, because seafood's supposedly low in fat. You can't have that damned red meat. And low-fat dairy. Got to have that low-fat dairy because you just don't want to have fat in your body. Now, in the previous video, I showed you how it turns out saturated fat has nothing to do with cardiovascular disease. These guys haven't figured that out yet. And the people they interview in here, the experts, haven't figured that out yet. They're all running on a very tired bandwagon that's been around for a long, long time. And they start this off, classic American dinner, juicy steak with side baked potatoes, smothered in butter and salt, add some rolls, and later a slab of chocolate cake topped with ice cream. And your taste buds are in heaven. Now, they want you to replace that with more vegetables, fruit, and as I said in the previous video, what happens when you try and go low fat is you replace those fat calories with carbohydrate calories. And it's turning out that we are now realizing how dangerous carbohydrates are. They lead to high releases of insulin, and they lead to high releases of glucose or blood sugar, which is involved in the glycation process, which is the cause of all the diseases of aging that nobody's even talking about. They don't mention in this article. So we just go ahead, eat more fruits and vegetables. There's no harm from that. In fact, it's just going to benefit you. That seems to be the party line. So they say these things without producing any evidence whatsoever that it's good. They just say. And then they go interview some registered dietitian or a PhD. And this one guy says, I like this quote, I've never known anyone who got overweight eating more fruits and vegetables or drinking fat-free milk. Well, all you need to do is look at some of the very fat vegetarians, and that will show that this guy doesn't know what he's talking about either. There are a lot of fat vegetarians, by the way. We can also say there's a lot of skinny fat vegetarians, and there's a lot of skinny fat people who aren't overweight in terms of the scale, but who nonetheless have a lot of body fat on it because they lost a lot of their muscle tissue. So this is what you're getting. This is where you get your information. And they want you to add more whole grains. It's the best choice because you can't eat those refined grains because they don't have any vitamins and minerals in them. But the whole grains are still loaded with carbohydrates, so you're going to get all the negative effects of the increase in carbohydrate intake. So what's happening now is the evidence is becoming very, very clear that carbohydrate restriction is the default diet to help prevent cardiovascular disease, diabetes, diseases of aging, all these things. It's carbohydrates that were always the main culprit. And that's of course what the glycation theory of disease and aging says. That's glucose, and glucose comes from carbohydrates. So we're getting there, but the information is not getting into the consumer's hands. It's being controlled and distributed by these large organizations who are still spewing out the same old nonsense, because none of them are doing any research. They're not reading it. They're not trying to stay up to date. And you, the poor consumer, is just befuddled. And then you stick to these old cliches and old ideas about what's healthy to eat, think you know what you're doing, think that you are eating healthy, and you're just being conned, you're just being brainwashed. So that's why I put this site up. I want to get this information out to the public so you can see what you've got to do to protect yourself and improve your health, instead of listening to all these clowns who just don't do their homework. And there's no chance that they will, because why change? There's no sense in changing, because they're stuck in the mud. They're stuck with this thing. And that's just a fact. Thomas Kuhn, who wrote the Structure of Scientific Revolution, knows this and knows that people aren't going to change. They're going to hold on to their existing belief system and just keep sending it out. So you're just going to keep getting bombarded with this. And you need to come here, watch these videos, read the blog, read my books, if you want to get a handle on getting sound scientific information coming from the research papers. There was a recent analysis of the effect of saturated fat on heart disease, and it clearly showed that there was no relationship. So when's that going to get out? It's certainly in the scientific journal, but it's not going to get out. It's not going to get in USA Weekend. Our medical editor guy is not going to get it. He's not going to tell us. And people are going to tend to believe these guys and follow their advice. So that's why you have to be really, really careful about what you listen to, who you listen to. A lot of the vegetarians accuse me of my credentials, but I do have a PhD degree from a medical school. PhD is the highest academic honor you can achieve. I'm a trained researcher. I've been doing research in the medical journals since 1977. And before they even had PCs, we'd have to go to the big library and do that. So I know how to do this stuff. I know how to retrieve it. I know how to read it. And I know how to inform. I know how to provide this information for you. Okay. I'm Dr. Greg Ellis.